even, well-known journals are starting to publish that there's somehow emotions are being stored in our physical bodies. We don't get it. We don't know how it happens. And it does sound woo because it's not something we've ever looked at before, but they're starting to recognize like there is definitely a correlation here between traumas and emotional issues and chronic issues like migraine, fibromyalgia, chronic fatigue syndrome, things like that. So this
Yeah.
is absolutely extremely important. And I would say 100% of people need to be looking at and addressing. And this is something that we spend weeks on in our program as well, is kind of assessing and looking at emotional barriers, emotional traumas. Have you worked through everything? Um, and can you talk about what happened? And if you can't talk about it because, it makes you uncomfortable, nobody wants to, but can
Yeah.
you? Some people just can't. And if you can't, even though you've done years and years of therapy, you're not ready yet. Like there's still issues that are unresolved. You should be able to talk about it. Doesn't mean you should want to talk about it, but you should be able to talk about it without having any kind of physical discomfort or increased heart rate. Like it should just be another story that you tell.
Yeah.
And that's usually a lifetime, right? If you ever even succeed. So I have a lot of clients who are like, well, I went 2 to 3 years of therapy and I addressed those issues. And then they're like, I don't want to talk about that anymore. And I'm like, okay. And I get that. And I'm super sensitive to that, but that's going to be a sticking point. And so we just have to have that conversation. And if they still aren't in a place where they're ready to let go of those emotions and deal with that trauma fully, or continue dealing with it, I should say, not that they haven't dealt with it, but then, there's always going to be this ghost of an issue that's contributing to the migraine picture, right? And um, it's a really, really hard conversation to have and to really truthfully assess whether or not, even if you've gone through a decade of work, is it enough? Has it been enough? Have you fully been able to let go? And really, the highest percentage of people that I've found that can talk about it are those that have also engaged in a spiritual or religious practice that has allowed them to move past the physical traumas that happened, and relying on their relationship with God to help them move through that. And the ones that and I bring that up because I feel like it's very, very closely tied. And there is, again, so much research on how having regular religious practices and having a relationship with God outside of your own being will actually improve outcomes across the board in chronic issues, from cancer to autoimmune disease to migraines. There's research on dental health and spirituality. So this is like a huge piece, I think, that we're missing in the medical community, that we're not addressing, that will allow our patients and clients to be able to fully assess their emotional standpoint. Like, I don't know if we can get over things that happen to us on our own strength, right? I fully believe like we need God's help to move past some of these horrific things that happen. And I feel like that can be a piece of why some people get stuck in that and some people are able to work through it and let it go.